customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408.
You are listening to the Ask the Experts show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 5 to 6 p.m. Now, get ready for more Ask the Experts.
And I love the guy Ken here who does the show here. He's the best producer. He's the best. And we have a lot of producers around the country. Good job, Ken. Anyhow, what a great show today. All of our shows today have been unbelievable. This was a show that you wrote us about. You said, how come you don't do a show on ED? I've never heard one before, and that's because we haven't. But today, we have the greatest clinic. Now, this is a clinic that it's called Broward Urology Center. Now, if you're in Palm Beach, it is worth the drive, I'm telling you. And today's show, we have got one of the top doctors over there, Dr. Eric Chenven. You know, if you hadn't told me anything, I would have just gotten it perfect. But Dr. Eric Chenven, so easy. It's a good Chinese name. Anyhow, welcome to the show. You did so well last time, and it's scary. We've got thousands of people who listen and watch the show, and it was your first time, and it was like nothing to you. You did really good.
Thank you.
So tell us about your practice. Where is it located, first of all?
So we're located in downtown Fort Lauderdale, and we are on Andrews Avenue, just south of 17th, close to 84, close to 595, close to 95 in our brand new location. We've been there for about 4 months in our wonderful new office. We also have a satellite location a little further north, just off of Commercial Boulevard.
Oh, okay. Now you're a urologist.
Yes, sir.
But you also have been doing things with ED. And you know what? Is there an age group, first of all, that seems like if there's ED that it falls under?
I think our biggest age group, although a big range, 50 to 75 years old, is probably the most common that we see. But I think I'm starting to see more and more men coming in their 40s.
Ooh, really?
Early 40s. Occasionally we get those 30-year-old men, but seeing lots more younger men coming in today.
What causes ED? And we're talking about erectile dysfunction, if you don't know what we're talking about. I know because I'm heavy set. That's one of the things, and I heard high blood pressure.
So there's lots of things that can cause ED. I think we went over that in a lot of detail the last show, last month. And sort of briefly, our biggest ones are diabetes, probably number one, heart disease or atherosclerosis, the clogged arteries. If we think about the heart, those big arteries, much smaller ones that supply the penis, are going to clog actually sooner than the heart. And sometimes ED, and just so everyone knows, ED stands for erectile dysfunction. But ED can actually be a harbinger or a predecessor to heart disease. So sometimes that might be a clue to say, time to talk to a cardiologist and get checked out.
Okay. So I would think men, especially younger men, are a little embarrassed, which they shouldn't be. But you can actually treat most of them.
It's a sensitive topic, but it's certainly a large part of a relationship and in people's intimate relationships and so on. And I think that today, thanks to Viagra and the big part, not just the honeymooners show and seeing what the bedroom looks like, but getting it out there and letting everyone know that it's a common problem, just like diabetes and blood pressure.
That's right. It is a common problem. And, I guess When they call your office, do you first do a history and physical on them?
100%.
Okay, that's the first thing
we're
you
taught
do.
95% of your diagnosis comes from a good history, so it actually means you have to spend a little bit of time talking to the patient and get a good history, background medical history, and then exactly what's going on with the patient. Up to that point, recently, we proceed with a physical exam, move on to some lab tests, like a testosterone level, especially in many men. And then from there could be further testing, certainly trial of some oral medications like your classic Cialis and Viagra and the newer generic equivalents. And then we might
So
do
there
more
are
testing from
generics
there.
out there now.
Absolutely.
Okay, because it does get quite expensive, doesn't it?
They have been very expensive.
I mean, you hear all these commercials now. People, you know how expensive Viagra is. Well, we've got something. But who knows what to listen to? See, I trust you. You're an MD. You're a doctor. I trust you. But all these ads I hear on TV and on the radio, it's just like, I got to tell you something. I don't know who to believe. So tell me, you don't just use the Viagra. You use other methods, too, for ED.
Absolutely. And I think we certainly do use the oral medications, but a lot of patients have come in that their primary care doctor has already tried the oral medications and they've either failed on them or they were working and are now starting to fail on them and they're just not happy. So that sort of leads us into a little bit of a diagnosis that a lot of people don't perform, and certainly not non-urologists would not know how to perform most of the time. That's often leads to an ultrasound of the penis, only at that point to really get an idea of the blood flow to see how we can gauge how
There's
far,
tests for
how
that.
severe the problem is. And then our next steps are historically all we had, even before the pills, were needle injections that, like the pill, when you wanted to use it, you would need to inject yourself with a very tiny insulin type of needle and take some time to really titrate up and get to the dose that you need. Since that time, also for a long time, we've had a pump, or we call them VEDs in urology, vacuum erection device, the old school kind of pump that by vacuum brings blood into the penis and causes the erection, but needs to be held in place by a constriction ring. Otherwise, once the vacuum is removed to have intercourse and any relations, then the blood is going to flow out if there's not a constriction ring holding it in. So
So it sounds
sometimes
like the
effective.
injections are the best way to go.
Well, for some men it works, and for some men it doesn't.
Okay.
So there are certainly those men, just like on the orals, that are failing the injections. They may have been using them for years or having to increase on the dose. And it's not uncommon to think that whatever caused their problem, whether it was their diabetes or blood pressure, usually a combination of many things. Certainly patients that have had prostate cancer and radiation and surgery and all kinds of treatments, that the disease state, the dysfunction, can progress. So whatever was working for them may not be working in the future.
Is there anything that's really long-term?
Well, I think, fortunate or unfortunate, the longest term is an implant.
Okay.
Which is a good treatment, but to a lot of men, they're not really interested in having surgery and having a permanent device in there and so on. For some guys, it is an amazing treatment and works great, and there are some guys that the injections don't work. There's nothing else we can do. The blood flow just isn't there, and there's no way at that point, because it's so poor, to get it there. But what has troubled me is that there hasn't been much else in between, some way to kind of repair things. And as a surgeon, I like repairing things.
Right.
And I think that is partly what distinguishes us as urologists, the genitourinary,
That's very important.
the genital experts, right, from the people who are just advertising to come in and get that guaranteed treatment, which is the needle injection that we've been doing for 50, 60 years.
Nothing new.
Nothing new, but still certainly effective and useful. So if I can fix something, I'd like to. And so a couple of years ago, I was doing some research and I had heard about the platelet-rich plasma injections and the shockwave therapy, and we had some data come out. We're still waiting on much longer-term studies and so on.
New.
It's definitely still new on the evidence horizon, but it's been used for many years potentially close to 10 years now in some very limited places. And of course, this is something that I've looked at for years as experimental, no results, and so on. But after doing some of my own research, reading some of my own articles, and going for a bit of a training to a urologist in Illinois, Dr. Bano, I've really come to see that patients coming in after having this procedure are really happy.
So you got to explain the procedure.
So what the purpose of these procedures are, these are categorized as regenerative medicine. So regenerative means just that, to regenerate, to heal, to repair. And it's really super cool. I can't even call it technology because it's the coolest technology, our own bodies. And we've learned how to harness the healing abilities of the body and direct them where we want to go. And this was really first used with the platelet-rich plasma in orthopedics, for joint injuries and joint pain, chronic wound problems in classically diabetic patients. It's not quite stem cell. And stem cells being researched.
I start thinking stem cells.
Stem cells take it even farther back. Okay. And to explain that a little bit, you kind of jump me to the next stage of explanation, and that's, so platelet-rich plasma is just that. We draw a patient's blood, and within the blood are certain cells, number of cells, white blood cells, red blood cells. We want to get rid of those and filter out just the platelets. We used to think the platelets just plug blood vessels and stop bleeding if someone got a cut or trauma. And what we've learned is that the platelets are like the Marines. They come in the first line to, yes, if there's trauma, to stop bleeding and so on, but then they're going to release about 8 different growth factors. They're going to stimulate stem cell production. So giving someone stem cells takes us back a little further in that cascade of healing, a little further back, and doesn't allow the platelet effect, which is also with signaling proteins, chemokines and cytokines, to get into the fancy medical terms. But those are signaling proteins to tell, I like to say, all the other armed forces to come in and help with the healing, whether it's eating up some dead tissue, helping to build new tissue and those stem cells, and cleaning out the blood vessels a bit. Might just be possible.
You can actually do this? You can get rid of red cells and white cells and actually clean it out?
Well, for us to do that, the red cells are in the blood that we draw. So we take some blood from your arm the day that we do the procedure, and you have to have a special device, a special centrifuge that's certified to do this kind of procedure and isolate out your platelets. And then you inject them to where you need them. So similar to the injections that we talked about that directly stimulate an erection, we use the platelet-rich plasma and we inject it into the penis. And the two sides communicate, but we will still sometimes inject both sides or one side in particular based on the ultrasound findings. And then from there, the platelet-rich plasma actually kind of binds into the tissue a bit. And the only thing from the outside we're using is calcium, a tiny bit of calcium, to activate the platelets. And the further blood flow into the penis is going to help with that.
Wow. God, I would say let's just go right there and do that. So this is actually someone where the pills don't work, or they've stopped working. The injections have stopped working. This is the next step.
This is the next step, or at this point we kind of call it the next step, but perhaps this is the predecessor to any of those other treatments at some point in time, which I don't think we're there
yet. You got to
tell
me the kind of results you're getting.
Well, I think typically the results that are published are about 75 to 80%.
That's good.
It's good, but I think we got to look at those numbers and get a little longer-term data and so on, and really be realistic with the patients. For the guy that has a little dysfunction and the low dose of the pill is not working anymore, but he's great with a little bit higher dose, versus the man who the pills don't work, now the needle injections don't work, and really looking to them and customizing the treatment for what each man needs, because each is different from the next.
Gotcha. Okay, we are going to go to break. Give everybody your phone number.
Our phone number for the main office is 954-463-6408.
And you got a great website. What's your website address?
BrowardUrologyCenter.com.
Write that down, because starting next week, the show's going to be on there. on your website.
I think so.
Yeah.
And the Facebook page, too.
And the Facebook page. We're going to go to break. We'll be right back. We're here with Dr. Eric Chenven.
Are you suffering from erectile dysfunction, also known as ED? The urologist at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408.
And we are back. We're in our final 15 minutes of our Ask the Expert show. Speaking of experts, we have Dr. Eric Chenven. He's one of the principals at Broward Urology Center. See, we get the best. We have the MDs doing this. And this is really where it should be. And we're talking about all the different services they offer. Now, you offer other services, other urologic services that men can come to. Besides this, I just want to get those out there before we go further. Some of the other services that you provide.
Well, we're certainly full-service urologists, I guess you would say, and we handle, as I mentioned before, the genitourinary system. So that goes from the kidneys, which start with the urine, all the way down to the bladder and all the way out to the urethra and so on, and any disorders, kidney stones, cancer of the kidneys, the bladder, the prostate, the testicles, all the related surgeries and workup for all of that, certainly enlarged prostate, and those are really some of the big,
I had
big
someone
items.
call, they thought you were on every week, and they called, they had a question. I had no idea. They said, what is the difference between a urologist and a nephrologist?
So a nephrologist is the medical side of the kidneys. So they're not surgeons, we're surgeons.
Okay.
They're medical doctors, and they handle the kidneys in terms of when the kidneys are starting to malfunction, certain disorders of the kidneys that can cause those problems, and then once the kidneys are not working, they're the ones that handle the dialysis.
Okay, that makes sense. Now, there's other things that you do also as it comes to ED, and this is a shock therapy.
Shockwave therapy or low-intensity shockwave therapy, so that people don't confuse this with the shock waves that we use for kidney stones, which is a much, much, much higher intensity and so on. In this case, it's been developed to, the shock wave is almost like a jackhammer, like a pile driver, so to speak. I don't want to make this as, it sounds worse than it is. Does require a little bit of numbing solution on the skin to just make it a little more comfortable. But what the purpose of this is to take even the platelet-rich plasma injections a step further back to, I had mentioned that platelets respond to trauma. So we've learned that with a certain degree of intensity on the shock waves, we can cause a little bit of trauma to the cells, kind of shake up the cells, if you will, such that the body now will react to it and interpret it as an injury and bring the platelets in from the blood with a platelet response and the healing cascade that goes from there. Again, too much intensity on the power would cause damage. We don't want that. And too little would not cause the body to react. So what I tell patients is that ED often kind of flies under the radar. The body's watch system of these platelets always running through the blood system, ready to act wherever and anything happens. But because the ED is happening so slowly, the body doesn't really get the message to react. So the shockwave therapy is done in the office again. It's usually separated into about 6 treatments, sometimes more, depends on the patient. But the general standard course of treatment is 6 treatments, which could be done either once or twice a week, generally speaking. So it's about over a 3 to 6 week period. And the treatments are applied to the penis. We use, like I said, a topical numbing cream just to make it a little better and so on. Generally not real bad. There are patients that don't want to use the numbing cream at all and so on. And with each of these treatments, there's, again, not much of any risk. Yes, the patient might get a little black and blue on occasion, but again, not to the point of real big hematomas, as we call them. I've never had that happen, where that's sort of a black and blue that bled even more into the tissue and created a lump. And as I said, for the P shot or the platelet-rich plasma, it's your blood. So there's nothing real foreign coming to the body, and so the side effect profile is close to none. Now, these treatments, just like healing, we get a cut. We know that cut's not going to be healed within a minute or two. So these treatments can take anywhere from 1 to 3 months to really start to see the benefit. And I think I alluded to using a vacuum erection device, a pump, during that time frame to really help expand the tissue, bring in the healthy oxygenated blood, and for some time reactivate the platelet-rich plasma while it's still hanging around, and to continue that healing process. So I've certainly had patients have some early on benefit and improvement, but I've had patients with absolutely no benefit in the first month or two, and at 3 months tell me that they are better than they were before they ever had a problem. Now, again, that's not everyone, and success is variable. And we will often also add something like a daily Cialis or Viagra or every other day to it, because some studies have shown, I think they were animal studies, but that we can see an improvement in results using that as well.
So if I'm sitting in my car now, I have a question. Tell me in what order. So maybe you come to you for the first time, it's probably going to be Cialis or Viagra. Is that right?
I think
Probably.
so. I think so in most men.
And then,
at least that's the initial
next
thought.
step after that? The injections?
Well, again, understand there are men that take the medication that it works well,
Yes.
but they have some horrible side effects. Horrible headaches,
Okay.
leg cramps, and they might get one side effect with one medicine, a different with another. So just like any other medical disorders, sometimes the medicine works, but the side effects are intolerable.
Gotcha, okay.
And that might lead us to some other treatments and so on. And certainly for someone that we know that still has a good response, those might be good candidates for the regenerative therapies if that's a road they want to go down.
Are there candidates that just nothing ever works for?
The answer is absolutely yes. And we talked a little bit before
But you did
about...
have to think about that, though.
Sure,
So that
sure.
tells you.
And that's the point of the ultrasound, because to just treat every man as the same as every other man that walked in yesterday and is going to walk in tomorrow, and everyone should get a treatment like the shockwave therapy or a P shot, I don't think that's right. I think we have to evaluate a man, and the ultrasound is that objective way, after a good subjective history from the gentleman, to really find out the level of dysfunction. And when we do the ultrasound, we will give a test dose, a very low test dose of that injection medication that directly stimulates the erection, not the P shot, at that time. So the man gets to see, hey, this is the tiny needle, not that big a deal if this is the route I want to go. But it also allows us to see what the resultant blood flow is like with that stimulation, with the medication. And if it's terrible, if it's looking to be like something we can never fix, then that's the guy that's going to be a good candidate for an implant. And I'm not going to waste his time, energy, and so on with any of those regenerative therapies or even the other treatments.
Implant works for sure.
Implant works for sure. As long as the device, most of them are a pump, so it has a reservoir with fluid in it that then transfers from one area to another to fill the channels in the penis and directly cause an erection.
What service do you feel gives the best results?
I think in talking with men over my career, a little over 16 years in practice now, is while I think a pump is an excellent treatment, I think if I can have a man's own body working for him, then I think he's going to be the happiest, because there are some drawbacks to the pump sometimes in terms of, I guess I would call it the fit of the pump and just things that can happen when it's in there. We're trying to recreate nature, and so it's not always perfect, that some men are not as happy with. And I think if they could have at least been tried with some of these other treatments, if they were a candidate, then they might be happier.
So platelets, the shockwave, those are really good treatments.
Certainly.
So I got to ask you, and please be honest with me, why should they come to your clinic? Why should they come to the Broward Urology Clinic?
Well, I think because we're urologists, and meaning we're the penis specialists. And it's not something that we just picked up in a weekend course. This is something that we train for. This is what I went to 6 years of residency for, to train and do this. And it's not something I picked up in a weekend course or didn't even talk to a urologist on how to do. And I think if any disorders, if you get cancer in the penis, God forbid, shot, stabbed, injured, anything, patient's going to be coming to us for the solution. So why would you go to someone else for any other disorders in the penis?
I love that. I love the fact that you're a urologist. I think that makes such a huge difference. The name of the practice is Broward Urology. Give them your phone number.
954-463-6408. And just to clarify, it's Broward Urology Center.
And Dr. Chenven will be back. Why? You know, I have Chevron on my mind. It's not Chenven. Will be back with us next month. And please, if you are having a problem in that area, this is the clinic that you want to go to. And I'm telling you that, and you'll be back next month. We'll be talking about it more. Don't Google something like this. Go to people who are experts, MDs, that this is what they do. And listen, I thank you for coming on the show.
Thank you so much again.
And we'll be back again next week with more Ask the Experts.
See you then.